This is Lily. She is a freshman in high school. Recently, she has been feeling sluggish with little energy. She has even started falling asleep in class, but not because of her algebra lessons. Lily is usually happy, but recently she has been feeling depressed. Her parents thought that it might be that she was having some problems adjusting to a new high school environment. On top of all of this, Lily has also noticed that her skin feels dry and that she has constipation problems. Her clothes are feeling a little tighter than normal. She's gaining weight, though she hasn't changed her diet or exercise routine. Lily doesn't feel like herself. The symptoms do not go away, and her parents take her to visit a primary care doctor to see what's going on. Lily makes a complete list of her symptoms. The doctor suspects a thyroid problem and recommends a blood test to include a test for thyroid function. Lily has never heard of a thyroid before. So what is a thyroid? The thyroid is an endocrine gland that regulates growth and metabolism. It is situated in the region of the neck and is shaped like a butterfly. The thyroid is part of the endocrine system. The endocrine system helps your body function properly by producing hormones and releasing them to the bloodstream to communicate and coordinate vital processes. The endocrine system includes the pineal gland, hypothalamus, pituitary gland, parathyroid glands, adrenal glands, pancreas, kidneys, ovaries, testes, and the thyroid gland. It is an example of how different parts of your body work together to keep you healthy. Your thyroid produces hormones, called thyroid hormones. One special feature of the thyroid hormones is the presence of iodine. When you take in iodine from your food, it goes to the bloodstream and gets picked up and concentrated in the thyroid. Iodine is needed to make thyroid hormones. These hormones travel in your bloodstream to reach every cell in your body and regulate how your cells and metabolism work. For example, these hormones play a role in regulating your heart rate or how fast your intestines process food. Thyroid hormones are regulated through a feedback system between the thyroid that produces thyroid hormones and the pituitary in the brain that produces thyroid stimulating hormone, or TSH. TSH stimulates the thyroid to make and release thyroid hormones. As thyroid hormone levels go up in the blood, they send signals to the pituitary to reduce the production of TSH. This prevents too much from being made. If thyroid hormone levels are too low, the pituitary gets the signal to produce and release more TSH to ensure that the thyroid hormone levels are optimal. Lily's blood test results show that she is perfectly healthy except for her low levels of thyroid hormones. In other words, she has hypothyroidism. The doctor refers her to see an endocrinologist, Dr. Ashton, who specializes in the study of hormones. A more detailed blood test is done to include not only a test to test the levels of thyroid hormones, but also that of TSH, and an antibody test for the presence of abnormal antibodies against thyroid peroxidase, TPO antibodies, an enzyme normally found in the thyroid gland that plays an important role in the production of thyroid hormones and other proteins such as thyroglobulin. Dr. Ashton explains to Lily and her parents that her symptoms are consistent with that of hypothyroidism. Symptoms can vary from person to person. Hypothyroidism is more common in females than in males. Symptoms can include fatigue, depression, hair loss, sensitivity to cold, weight gain, joint and muscle pain, and irregular menstrual periods. Behavior changes, changes in school performance, and persistent belly pain are also common symptoms seen in teens with hypothyroidism. Hypothyroidism usually causes some delay in growth and development. Physical growth and sexual development are the most affected. Puberty can be delayed, and children may have a slower growth rate. What causes hypothyroidism? Hypothyroidism can be caused by an autoimmune disease, too little iodine in the diet, thyroid removal, radiation therapy, or use of certain medications. The most common cause is an autoimmune disease called Hashimoto's thyroiditis or Hashimoto's disease. It is an autoimmune disease. In other words, your immune system attacks your own cells and tissues. In the case of Hashimoto's, your body produces antibodies that attack and destroy the thyroid gland. Lily's blood test results show low levels of thyroid hormones, an elevated level of TSH, and the presence of anti-thyroid antibodies, thus confirming the diagnosis of Hashimoto's thyroiditis. Another autoimmune disease of the thyroid is Graves' disease, which results in higher levels of the thyroid hormones, known as hyperthyroidism. They mimic TSH in stimulating the thyroid to produce increased amounts of thyroid hormones. Fortunately for Lily, the treatment for her condition is relatively straightforward and effective. It is basically to use a medication to increase the level of thyroid hormones. Dr. Ashton prescribes levothyroxine, a synthetic hormone that acts like the natural thyroid hormones. The oral medication restores adequate hormone levels and reverses all the symptoms of hypothyroidism. Lily and Dr. Ashton work together to see that Lily receives the right dosage. To determine the right dosage initially, Dr. Ashton checks her level of TSH after a few weeks of treatment to adjust the proper dosage of the medication to make sure that her thyroid hormones are at a desired level. Levothyroxine causes virtually no side effects when used in the appropriate dose and is relatively inexpensive. Treatment is usually lifelong. Lily has been on her thyroid medication for a few months now. She is finally feeling back to her normal self, happy, healthy, and energetic.